During menopause and perimenopause, there's all kinds of changes occurring due to the lack of estrogen. And what some women don't realize is the effect that estrogen can have on your brain. So estrogen kind of helps your brain metabolize sugar. So that leads to a lot of the brain fog and moodiness that some women experience. And also the thermoregulator is in your hypothalamus. So the lack of estrogen causes the hot flashes. So not only is it a reproductive hormone, it affects your brain. So estrogen also can affect the receptors in your tongue. So some women will notice that, things are tasting a little different. Their mouth may become a little more dry. It can affect your ligaments in your joints. Some women get frozen shoulder because estrogen can affect the elasticity of things. And in regards to your heart, when you get a decrease in estrogen, it can affect your blood vessels in that same way. So that's why women become at an increased risk of heart disease when they become perimenopausal. It changes how your lipid levels. So a lot of women will notice, hey, I had good cholesterol before I went through menopause, and all of a sudden their LDL, which is that bad cholesterol, goes up, and their HDL may take a hit. It also affects the way that women distribute fat. Usually we distribute fat in our breasts and maybe our hips and our thighs, but after women go through menopause, they'll notice that their visceral fat or their abdominal fat will increase, which also increases their risk of heart disease. There are tons of different ways we can support women who are going through perimenopause and menopause. One of which is yes, hormonal treatment, but there's also non-hormonal treatment options. If weight management has become an issue for you, because sometimes as women go through menopause, they experience, oh, wait a minute, I used to could eat this, now my metabolism has changed. Reach out to your physician because they can assess if you're a good candidate for what treatment options. The goal here is not to suffer in silence. Menopause is a transition. It's not a disease. We're here to help, so don't suffer alone. A lot of times as women, we put ourselves on the back burner, but as we enter menopause, I think you need to put yourself to the front of the line of taking care of yourself. So, and a lot of times, symptoms can be improved with exercise, strength training, or some of the non-hormonal things that you can do to help yourself feel better. But first and foremost, put yourself first and try to take care of yourself.